I'd like to reiterate some of the incredible positive messages we've heard. You know, there has been remarkable work done by so many bodies, volunteers sector, council officers, health officers, all sorts of people. And I'd especially commend, you know, the work that Gary's team did with the Volunteer Centre, Greenham Common Trust, and the key workers from the council, the refuse collectors who often get forgotten and things like this, who've helped keep people's daily lives going and keep people. But I think one of the things we cannot get away from is we have some tough questions to ask. And I think we've got some tough questions that the board have got to think about in terms of the speed of its response, how it responded. Could it have done some more? Because the COVID crisis has affected, I think, every single partner here. And we've tended to occasionally revert back to a little bit of less integrated work on some areas that might have changed things. And, you know, just picking up on some quick stats on these tough questions, you know, the COVID death rate in West Berkshire is higher than Australia. It's concerning that our care home deaths are higher than our acute deaths. You know, Professor Lum presented to Parliament yesterday from Hong Kong, who've had 0 care home deaths. Now, obviously, we've got to disseminate what's national issues that we have to work with and what we could locally potentially have done differently or better. And that in itself is a challenge. But, you know, the country appears to have been preparing for a flu pandemic when actually we got hit with a SARS pandemic. And that's had a huge effect. So in ramping up you know, the acute capacity and things like that, which we did. And Dr. Winfield talked about this, that when we did start to create the capacity, that infection control in care homes possibly didn't get the attention or the resources or whatever it possibly needed, because just day to day, hospitals are far better, more agile at worrying about things like infection control of highly dangerous infectious diseases. So, you know, I absolutely agree with all the sentiment of the board that the response from West Berkshire and also the community of West Berkshire has been phenomenal. But I think we have to look at some of these tough questions and say, could the board have been more helpful? You know, we've had various committees not sitting, which I think should have sat. The integration board didn't sit, the care quality board didn't sit. And I want to commend the CCG for its absolute transparency. Certainly with us as an organisation, we were invited into weekly calls. We were told exactly what was going on in ITU, numbers, capacity, etc. And also, most importantly, we were allowed to feed back into the system of where we felt there were challenges. And basically, we either got answers or, you know, effectively it was fed back to national, that issues like dental or prescriptions, where we had the national volunteers standing on the toes, the community volunteers. It was very much a two-way thread, and I'm not clear that was happening as much in the social care home element. And I just think there should have been more transparency on this side, because it became clear quite early on that this was going to affect our frail elderly, and not just in hospital, but also in the care home setting. And I think also we've got to take the positives we've talked about in terms of how we do things differently. We have become quicker, faster at doing things. And also we've actually got this amazing community spirit that we're using, that's working day in, day out, of getting food, medicine, all sorts of things out. We've got people making scrubs for the NHS. We've now got people making scrubs for care homes in West Berkshire, which is absolutely brilliant. You know, and it's a change in attitude in terms of, you know, I may not be the care home, I may not be the nurse, but I can help. And we absolutely have to capture that. But I think the board should commit to having a very quick ramp up of recovery boards, making sure we get these key learnings learned quickly. You know, there's no point talking about it in 4 months' time. COVID is going to be with us for some time. There's a high possibility of a second wave. And I think where we potentially could have done things differently or better, we've got to make sure we do when and if something similar happens again. So sorry, it's a bit rambly, but we have so much information given to us from different sectors. It's very difficult to pick out specific questions. Obviously, our vulnerable groups, so learning disability, the BEMA group, we really do need to do some specific work there. You know, we've still got people in the LD care sector without access to broadband. You know, and that and that's the sort of thing where you would hope quickly the system could say, right, that's difficult, let's do something about it.